One of the most troubling surprises for new Medicare beneficiaries is that their healthcare in retirement is far from free. Although you've likely been paying FICA taxes throughout your working years, those taxes only fund one part of your Medicare. In this video, I'll explain which parts cost money and why. Hi there, I'm Danielle Roberts, co-founder of Boomer Benefits and the best-selling author of 10 Costly Medicare Mistakes You Can't Afford to Make. Each year, Medicare sets its prices on premiums, deductibles, and co-pays. It is common for us to see these premiums increase each year due to inflation and also the rising cost of healthcare. That said, I am happy to report that the 2023 Medicare costs include several decreases. This is certainly the silver lining in a year during which many Americans have felt the weight of inflation bearing down on their everyday expenses. Before we jump into the numbers, take a moment to hit subscribe on the red button below. You will get instant notifications when my team and I release videos and information that impact your Medicare benefits. Medicare Part A is your hospital insurance. For most people at age 65, Medicare Part A costs nothing. This is because during your working years, most of you paid FICA taxes that were deducted out of your payroll checks to prepay for your Part A hospital insurance. If you worked for at least 10 years or 40 quarters, or you're married to someone who did, this will qualify you for premium-free Part A. If you do not have the qualified work history, you can purchase Part A for $506 a month in 2023. But if you or your spouse have worked at least 30 quarters, you can get a prorated premium of $278 a month. Each part of Medicare also has a deductible that is set each year by Medicare itself. Part A's deductible is per benefit period, meaning you could pay it more than once per year if you have several inpatient stays. In 2023, the Part A deductible is $1,600. Now, moving on to your outpatient coverage, Medicare Part B. Part B, unlike Part A, has a premium that you'll pay every month. Social Security will deduct this premium out of your benefits check each and every month. If you're not yet taking Social Security benefits, then you will get a bill in the mail each quarter. Here's a tip that I always like to mention in videos like this one. If paying the premium quarterly is a hardship for you, you can contact Social Security to set up a monthly bank draft until you begin taking your income benefits. You'll find a link with more information on this in the description below this video. There is a base premium for Part B that the majority of Americans on Medicare will always pay. In 2023, the standard base premium for Part B is $164.90 per month, a $5.20 drop from 2022. About 95% of Medicare beneficiaries pay only this base premium, but some will pay more based on higher income. We call this the Income-Related Monthly Adjustment Amount, or IRMA. This is a fancy acronym that could be summed up by saying if you earn more, you're going to pay more for Medicare. IRMA currently applies to anyone earning more than $97,000 as an individual filer or $194,000 if filing jointly on a tax return. There are 5 different levels of higher incomes depending on your modified adjusted gross income from 2 years ago. So here's how this works. The IRS sends your most recent tax return over to Social Security every year so they can calculate your Part B premiums for the upcoming year. People in the highest tax bracket will pay more than $600 a month for Part B. It is critical to know this information ahead of time before enrolling to Medicare so that you don't have any last-minute surprises. In the notes below this video, I'll include a link to our Medicare Cost page where you can look up your current income to see exactly how much you can expect to pay for your Medicare premiums in 2023. Now, here's a tip for those of you who have recently retired and were earning significantly higher income 2 years ago than you are earning now. You do not have to wait for Social Security to catch up to you. You can file a reconsideration request to ask them to reevaluate that premium based on documentation that you provide of your lower income since you've retired. I made an entire video specifically explaining how this process works, and I will provide a link to it below. Like Part A, Part B also has a deductible. However, Part B's deductible is much smaller and is only paid once annually. In 2023, the Part B deductible is decreasing by $7, making your annual deductible $226. Now let's talk about the very popular program for outpatient medications, Part D. There are more than 49 million Americans enrolled in Medicare Part D prescription drug coverage. When you enroll in Part D, you do not do this at the Social Security office. You're going to enroll in a Part D plan by choosing a plan that's offered in your state by a private insurance company. The base cost of these plans is set up by the individual insurance companies that offer them. And these premiums can range anywhere from around $7 a month to over $200 a month, depending on your state, your county, and the insurance company that's offering the plan. However, the national average Part D premium for 2023 is around $32 a month. Just like with Part B, Social Security can tack on extra premiums if you're in a high income bracket. Premium is not the only consideration though when looking for the right drug plan for you. You can determine which plan would be the most cost effective for you by using the Medicare Plan Finder tool inside your personal mymedicare.gov portal. Here at Boomer Benefits, we run the initial Part D analysis free of charge for anyone who enrolls in their Medigap or Medicare Advantage policy through our agency. It won't cost you a penny and it can save you hundreds of dollars on your annual Part D spending. Part D also has an annual deductible that Medicare itself sets each year. In 2023, the Part D deductible is $505. This is the maximum that insurance carriers can set for the deductible. However, they can set it lower if they wish, so you will see plans with deductibles ranging from $0 to $505. Here's my tip for Part D. The plan with the lowest premium is usually not the plan that is going to be the most cost-effective for you. Why? Because enrolling in the plan with the lowest monthly premium isn't much help if 3 of your important medications are not included in that plan's coverage. The reason to use the Plan Finder tool is to see which plan offers the overall lowest annual out-of-pocket spending. This takes all factors into account, including your premiums, your copays, and everything that you can expect to spend on your medications under Part D. If you've watched our YouTube video about how Medicare Part D works, then you already know all Part D plans have 4 payment stages. These are the deductible stage, the initial coverage stage, the coverage gap or donut hole, and catastrophic coverage. Your spending on prescription medications will vary depending on which stage you are in at any given time. For example, you pay all costs for your drugs up until you reach and satisfy the plan's deductible. Then you will enter the initial coverage stage and pay just a copay or coinsurance amount for each covered drug. In 2023, if your drug spending reaches $4,660, you will enter the coverage gap or donut hole, where you will pay up to 25% of the cost of your covered drugs. And if you continue to fill prescriptions and your spending reaches $7,400 in the calendar year, you will enter the catastrophic coverage level. At this stage, you will pay no more than 5% of the cost of your medications for the remainder of the year before all of these costs reset in January. Some people take so few medications that they never even get out of the deductible stage. Others who take more medications, and especially brand name medications or specialty drugs, may be spending money throughout all 4 stages. So it's fair to say that Part D is far better than having no drug coverage at all, but it certainly does factor into the costs that people need to plan for in retirement. Medicare Advantage plans, or Part C of Medicare, have a maximum out-of-pocket limit to protect you from spending beyond a certain dollar limit on Medicare Part A and B services each year. Once you meet the maximum out-of-pocket limit, or MOOP, your plan starts covering your approved A and B services at 100%. Medicare Advantage plan carriers can set their limit lower but not higher than the maximum allowed MOOP. The maximum allowed limit is increasing to $8,300 in 2023. Again, some Medicare Advantage plans can and often do set their maximum out-of-pocket limits lower than the maximum allowed amount. This is great for you because it caps your spending sooner. Be sure to look at the limit each year as it often changes annually. So there you have it, Medicare's 2023 costs. Now that you've got the cost down, you can start looking at what type of Medicare plan you want to purchase to help lower your out-of-pocket cost. For some people, Medicare premiums are much lower than what they were paying for employer coverage, and for others, it's a major unexpected expense. Drop a comment below letting me know what you think about the current costs of Medicare. If you want to save money on your plans or you are just getting started and want expert guidance, give my team a call at 817-249-8600, where you will get old-fashioned customer service, the kind of service your parents were used to back in the day. Remember, our help is always free to you. Thanks for watching, and I'll see you in the next video.